Today I'm going to share my conversation with Dr. Michael Kim all about lip lifts. I will put all of Dr. Kim's information down in the description box, and I'll also put it in a pinned comment. Now, if you're interested in hearing about my experience getting a lip lift, my recovery, seeing some recovery photos that I snapped with my iPhone, so they're not like professional camera or anything like that. Lighting is all over the place, but you will definitely get a good idea of what my recovery looked like. I'm going to put all of that at the end of my conversation with Dr. Kim. So those of you who are not interested in seeing swelling and stitches and some of that stuff, you will know that at the end of my conversation with Dr. Kim, that's when that part starts. I'll put a timestamp right here if you're interested in going right to that and seeing that first, or you want to skip there anyway. That will be at the end of the video, and I will just give you my general, kind of like what my experience was with the actual procedure and then my recovery. And of course, all of those pictures will be there as well. So I am going to roll into my conversation with Dr. Kim, and please do be kind in the comments. Say thank you to Dr. Kim for so generously dedicating his time to this, because I paid for my procedure, but he is gifting us his time and expertise in answering all of these questions, and I really do appreciate that so much. All right, you guys, I will see you on the other side. I am here with Dr. Kim, and we are going to discuss lip lifts. So without further ado, I would love it if you just told us a little bit about yourself, a little bit about where you've gone to school, where you practice, and all of that good stuff.
Thank you, Penn. My name is Dr. Michael Kim, and I practice in Northwest Portland and have been practicing in the area for about 15 years. I grew up in the Seattle area, Seattle and Bellevue, and through schooling, I went to the East Coast, went to Princeton for undergrad, came back to med school in Seattle at University of Washington, did residency back on the East Coast at Johns Hopkins, came back west to OHSU, Oregon Health and Science University, for fellowship. And then my first attending level job was in Scottsdale, Arizona, at the Mayo Clinic there. Returned back to the Northwest here in Oregon and have been practicing for about, 11 years now. And I practice exclusively facial plastic surgery, so facial rejuvenation surgery, rhinoplasty, and then procedures such as the lip lift. And those are some of the things that I'm most well known for.
Can you explain what a lip lift is?
Yep. And so a lip lift is a surgical procedure that can be done as a standalone procedure or as an adjunct to other things such as like aging face procedures like facelifts. And it's really meant to rebalance the proportions of the lip. Whether it's a patient who has a longer lip that they were born with or has developed a longer lip over time. It spans demographics, so there are younger people who are getting lip lifts and there are older people getting lip lifts. It's one of those things where as we gain better understanding of lip anatomy and lip proportions, we're not just using filler in everybody all the time anymore, because sometimes in the wrong patient, adding volume to the red portion of the lip just creates a weighing down and an extra length of the lip that creates a less proportioned, less beautiful lip. In older patients, what happens is the lip tends to lengthen over time. The white lip, basically the white lip is the portion that is not red, and then the red lip is the plump lip where you would get lip filler. What tends to happen is that the white lip tends to lengthen and the red lip tends to shrink. And then the overall cumulative effect is that it gets longer, all of it gets longer.
Right.
And so what tends to happen there is you get a obscuring of the incisor show, so teeth. And so that tends to be one major goal for older patients, is to see a little bit of incisor, because having that reproportioning and having a little bit of tooth show, it connotes youth. It's a more youthful look.
Okay, so who is a good candidate for a lip lift?
Yeah, so again, great candidates for lip lifts are patients who are born with lips that are disproportionate in that the white lip is too long and the red lip is narrower, and then others who develop that over time. One of the really nice benefits of a lip lift, in addition to just shortening the amount of white space there, is that it tends to evert the lip, this way so that you see a little bit more red lip. And so it's kind of like getting a plumping of the red lip without the use of filler. Now, some of those patients still will choose to get filler on top of that,
right,
because they're looking for more volume than that can provide. But it is a relatively simple way to just get a little bit more shell or more pop to the lip.
Okay, and who would be a bad candidate?
There are some patients who have very, very long teeth and upper gums and their jaws. And so someone who has a long lip, just physically by the numbers themselves, it could still be a relatively short lip in relation to their dental shell.
Right.
And so in those patients, you would have to be careful not to lift too much, or even opt not to lift them, because they might have too much shell and just be too much, rabbity, as what people do not want to look like. Right. And so that would be something that you'd have to assess correctly and then avoid if you need to.
How do you do that assessment? What's your procedure for consultation and then determining if somebody's good or bad?
Yeah. So it's looking at the goals of patients. And so I'll have some patients who are like, I don't want my lip to be any bigger, like my red lip any more shell. And, you have to have a conversation on that, in that, sure, you can do it to where your show is minimally changed, or your lip volume is minimally changed. But then you have to balance that with like how much tooth show you can achieve, or how much shortening you can achieve of the white lip. Right. So there are a lot of these different factors that go into it, and it ends up being that, like, having the patient in front of you, having a hands-on examination, being able to do measurements, and just play with the tissue a little bit in your hand.
Okay, so what kind of lip lifts are there, and what kind do you perform or prefer? And I'll load this question: how have they changed over the years?
There are many different kinds of lip lifts, but the way that I can describe my lip lift is that there are outside aspects of how we lift the lip, and there's internal aspects. And so traditionally, a lot of people may have heard of what's called the Bullhorn lip lift. And so the Bullhorn lip lift, all that describes is the actual general shape of the tissue that you're excising.
Okay.
So that's probably the most common one that's been done for decades.
Okay.
The problem with just making a blanket declaration of like, this is a Bullhorn lip lift and this is how it looks, is that it discounts some of the internal work that's done. Yeah. So the original lip lifts, and even how some people do it today, I think that the scars tend to not be as good as they could be. Yeah. And that's because there's a little bit of a lack of understanding of how best to minimize the scar. Traditionally, you would cut a segment of tissue out down to the muscle, but not through the muscle. And then you would take the segments that are remaining, the bottom of the nose and then the top of the lip, and put them together, side to side. And you would do deep suturing, anchoring there. The problem with that approach is that there are equal and opposite forces against each other. And so you can have some issues with how it can change the nose and the nasal position. And then also it's not anchored as strongly, so that there's just micro movements that can create issues with the scar itself. Yeah. You really want to have a scar that's like a repair that is very stable and is not going anywhere, even when you take the outside sutures out. So internally, what I do instead, it's essentially called a deep plane lip lift, where we're going all the way down to the muscle, but not through the muscle. And we are suspending the lip deeper below the nose, but deeper, like basically near where the bone is. Okay. And so in that way, it's not really creating any tension on the bottom of the nose. Right. All of the heavy lifting or the support is actually deeper and more internal. Got it. And in that way, you have you don't have nearly as much shear force or tension on that wound edge. Other things like early removal of the external sutures, injections of a steroid-like medication that I do at 1 month and 2 months, and then occasional lasering of that incision. Those are all strategies that I think make the scar look really good and tolerable.
So tell us about the corner lip lift.
Right. So when we talk about like the width of the lip, there's the nasal width and the width of the lip from corner to corner.
Mm-hmm.
And so maybe the ideal patient where you can do just the lip lift alone right underneath the nose is one who has relative width of the nose from side to side on the nostrils and relative narrowness of the corners of the mouth. And so that allows you to lift all across the lip from corner to corner if it's close. Usually if the width is about greater than 50%, width of the nose is about 50% of the width of the lip. Now in patients who have nice broad commissures, you know, let's say like Julia Roberts, really wide smile, and they have maybe a very narrow nose, it's hard to envision lifting that whole lip with a smaller incision that's from underneath the nostrils. Because you don't want to take that incision all the way across the cheek, because then it's very visible. And so the corner lip lift aims to alleviate an issue with just lifting the center and neglecting the sides, where the sides of the lip can be a little bit shrouded. So you're having the white lip kind of cover the corners, and so it just kind of opens up the corner of the lip there.
Okay. Can somebody do a corner lip lift only?
They can.
Okay.
And there are some patients who have relatively short or ideal length of the center of their lip, but the corners are quite shrouded and downturned. And so that's one adjunct procedure that you can do to help balance things.
Let's talk about the recovery.
We like to say that, you know, if you tell patients something afterwards, it's an excuse. If you tell them ahead of time, it's like good counseling. Yeah. So the way that I counsel recovery is that I tell my patients that within that first few days, and even like right after surgery, it can look pretty crazy. Yeah. Like because of the swelling and asymmetric swelling, it's going to look like you had an allergic reaction almost. Yes. With little sutures and things like that. Yeah. But really pretty quickly by day 5, when we take our sutures out, patients tend to look pretty good. Yeah. I mean, I think they look better than they expect in some ways. Yeah. With the exception of the incision sometimes has some crustiness. Yeah. You know, we're taking some in the sutures out, so you have like areas where the sutures were taken out can have like a little bit of like bloody crusting and things like that. But usually by like a 2-week period, you can put makeup on your incisions, and it would take good detective work to be able to tell that you've had something done, even though you're still in the throes of healing. A lot of the things afterwards that are visible are really visible to patients, but not really to other people.
I want to ask you about filler. If people have had filler, do you tend to, and there are going to be people who may come here to see you from out of town. So if they have filler, do you recommend them getting it dissolved? And if they can't see you, would you say, go get that dissolved before you come to see me? Or do you say, you know, what do you do with filler before?
That's a great question. And I'm sorry if this is for the people who I did have go get it dissolved or dissolved it. But in general, I have become much less militant about the filler dissolving. Yeah. And I'll caveat that by being a little bit more granular in the detail here. So before, I used to be like, yeah, we should just get it all down to baseline, try to dissolve as much as we can, and then, you know, it gives us a nice baseline from where we're going to lift. But in my experience, I think that we know that patients are going to get filler. And it's very likely for some, especially like our younger patients, they're going to want more filler on top of their lip lift. So now my general rule of thumb is that if you have migrated filler, especially like past the vermilion and up, then that certainly should be dissolved. Whereas the rest of it, if it needs to be dissolved later, it can be. I like to have patients have their dissolving session, you know, a month before their actual procedure, and that just gives it time to settle in. Right. You know, so it's not in a state of evolving.
So I got a lot of questions about how a lip lift can affect smile, and will it affect speech?
Great questions. I think in general, long term,
Yeah.
smile and speech unaffected.
Right.
In fact, enhanced in many ways, because if we're seeing a little bit more teeth, it's a more a youthful look. The model, I think the ultimate lip gold person is Brigitte Bardot. I think I've shared that with you. She was before lip filler, before collagen, before anything, and she's got this youthful, full incisor show, very full lips. So even though she's got that the lift there, she can close her mouth, and patients can close their mouth. They can feel funny early on, but not later.
Right.
Part of that is because of a non-disturbance of the muscle.
Yeah.
And that's where, when people talk about muscle techniques, that's where it gives me pause.
Yeah.
Is because then you're taking something that's aesthetic and you may be making some functional trade-offs that you don't want. Initially, you do have some dysfunctional stuff. And again, this kind of goes into the category of like, other people don't see it, but you do. And you may have experienced this, but the elevation of the central lip when you smile is somewhat restricted.
Yeah.
And so part of that, I believe, is because it's kind of a stunning of the muscle.
Yeah.
And also partially because the scar is hard. It just kind of restricts that little central movement up. And it's pretty subtle. The other things are, you talked earlier a little bit about like how the scar looks. Yeah. There's not just the incisional scar, and that looks great because it's right in the transition between the nose and the lip. But underneath the surface, there's that firmness that no one can see. Right. And that's the part where we do our steroid injections.
Got it.
And that's softening that up.
Oh, okay. I don't know why I didn't realize that, but that makes so much sense. Somebody's going to wonder about the millimeters, and I know it's case by case, but what's the average amount that you take out? I realize that everybody is different, but like, what's the minimum that you would say it's not even worth doing it if we're not going to do more than X? Right. What's the most you've taken out?
I think the most that I took out was about 8 millimeters.
Okay.
And that would have been in an older patient who was like 23 or 22 or something like that.
Millimeters, not age.
Millimeters, sorry. Millimeters of actual
length.
height. The greatest amount of vertical length that we've removed.
Yes.
In the minimum that I would take out, just because of trade-off of like how effective it's going to be or how much change it's going to be. Yeah. Versus like, having a scar and the cost of it and everything would be around 3 millimeters. Okay. I think anything less than that, it's probably not enough of a difference to make it a value.
Okay, so somebody asked how soon, and you kind of already answered this, but how soon would you expect to be in a social situation, and how soon could you expect to go back to work?
Great question. So socially, I think that it depends on the social event or the engagement. Yeah. Okay, so just like dinner with friends, drinks, night out, or going back to work, I think 2 weeks is appropriate. Yeah. If you're getting married or there's an event, or if you're on camera a bunch, or if you're getting like professional headshots, then I think that, you'd want to extend that further because every photo is on you and you're like person whose main, is in the focus, focus all the time. If you're the mother of the bride, also that type of things.
I want to backtrack a little bit. Just walk us through the procedure. Somebody comes in day of the procedure. How does that go? What does it look like?
Yeah. Well, a lot of the preparation of the actual procedure itself is done at the consultation. Okay. And so some of it is, photos, measuring, having patients animate, showing us what their lip looks like with slightly open mouth. I'll take the caliper, so like a really, really fine measurement tool, and measure different areas of your lip, and then just kind of making an assessment of what I think would look good or how much we should take. I try to simulate that, not digitally, but by using our tool to show the patients in the mirror, do you like how this looks? Right. And so we can kind of show them like a differences between like a more aggressive lip lift or a more conservative one. And so at that time, I have an idea of, how much we're going to take and in what places. On the day of the actual procedure, we'll reiterate those goals, show the patient again on like how it can look. And at that time, they've probably thought about it a little bit more too. And so they might be like, well, can we go a little bit more aggressive? And they'll show. And we'll make a plan to do that. We do some really precise measurements and markings. And I think that those are really, really, really important. I do that typically with patients sitting up, and partially sitting up because gravity has a way of affecting things. It's not as important in the lip, but like things like facelifts, you definitely want to do sitting up your markings because everyone looks a little bit more refreshed.
Yes.
Because things go backwards. So I often will prescribe or give patients a little oral sedative, and that just kind of gets you in a little zone. Then we do dental blocks, basically the same type of anesthesia that dentists use to block the mouth area, or more akin to like getting a dental block for lip fillers and things like that. And then the procedure is about an hour or so. We really use those precise markings because when you put the local anesthesia in, it kind of changes things. Yeah. And so those markings are really, really important. And essentially, the vast majority of the procedure, the important steps of the procedure are not the actual execution of doing it and putting stitches in. It's actually the planning part of it.
So if somebody wanted to see you and, because there's people watching from everywhere, do you do video consults?
I do video consults.
Okay.
We have a consultation process where we have patients inquire either online or through a phone call. And then the process is such that patients will send in some general health information, like what surgeries you've had, what medical issues you have, what medications you're on, and then goals. And then we also run patients through a process where they will send in some of their photos. And just to get a nice idea of whether a patient is a good candidate for surgery. Sure. And that initial process is a complimentary process. And then eventually, if we want to do either an in-person or a video consultation, then there's consultation fee. Can
you tell everybody if there are risks or complications that people should be aware of when they're considering a lip lift?
Sure. I mean, there are risks. And again, I think that experience does matter to minimize those risks. Yes. I would say, number one, if the practitioner does not do a good job in their technique of anchoring, in the deep anchoring that we've discussed before, then the scar can look not as good. And a lot of different factors go into how scars are. Some of them are patient factors, like some people scar a little bit stronger than others. In fact, a lot of younger people scars are a little bit firmer and harder initially than older patients. So I think that scar is one potential complication. The other things was too much taken or too little taken. In someone who does this a lot, if you're going to err, you want to err on the side of not taking too much, because even though it's unfortunate to have to revise, it's so much better to have to take a little bit out than to put stuff back in, because you can't do that. And so I think being overly aggressive is a potential pitfall for surgeons. It doesn't happen very often, which is a good thing. The other things are, I think that long term, if you have overly aggressive muscle treatment, rather than doing the deep plane lip lift in a more superficial level, then you can potentially run into issues with function. But as we talked about before, like some of the function aspects of things, although you do get them with even the best lip lifts, they are short-term in nature. And go away.
Okay, so I think we've covered everything here. I will invite everyone, if you have additional questions, you can leave them down below. I'll make sure to pass them on. And I really do appreciate this. Has been so fun. I'm really, really thankful that he took the time to do this. I'm going to leave all of his information down in the description box and in a pinned comment. If you would like to make an appointment for consultation, you can go through the information down below. All right.
Thanks so much for having me.
Yeah, thank you.
And I'm sure your followers really appreciate your transparency around these procedures, and you're such a font of information.
Well, no shame in this game as far as I'm concerned. So, it's good. And you're the best. So I appreciate you.
You're the best.
No, you. All right. I will talk to you in my next skincare video. Okay, I hope you enjoyed that conversation with Dr. Kim. Again, I will put his information, everything, his socials, his office information, all of that kind of stuff down in the description box, and then also in a pinned comment if you're interested in reaching out for more information from their office. Now I want to go through a little bit of my experience with getting a lip lift. First of all, my consultation with Dr. Kim, I had a couple because I talked to him about doing a lip lift several years ago and I decided not to do it then. And so this was probably like the third time I have actually talked to him about it. And at the consultation, he went through a lot of things with me. He physically kind of showed me what he thought it would look like. He determined and did a little bit of measuring, and he determined that I was a good candidate. He explained to me how the recovery was going to look. He was frank about that. He told me that there would be swelling. He told me that there would be, the stitches and what to expect. And it all exactly fell the way that he had explained. So the day of the surgery, you arrive, and what it is for me, it was local anesthetic. So it was some shots, as well as they give you a kind of like almost like something that will calm you down. I'm going to call it Valium, but I don't know exactly what it was. It's just a little pill that you take that kind of makes you sleepy, but there's no general anesthetic. At least I did not have a general anesthetic. But you really, other than those shots that numb your lips, you don't feel anything. You feel literally nothing, and you're kind of sleepy. You're sort of out of it. As soon as he's done though, it's pretty amazing because you come back from being out of it pretty fast. So at the end, he sits you up, and that's where I take my first after picture. I was literally still sitting there. I just had it done, and I could tell it was starting to swell, but there was absolutely no pain. And like I said, the only pain was the numbing shots. That was the worst part of that procedure. It was Dr. Kim and then a nurse with him during the surgery, and it was pretty straightforward. He did all of the drawing on me. He really took his time doing that. I felt like that was one of the longest parts of it, but then of course I was kind of under like woo-woo sedative after that. All of that kicked in, and it literally was like an hour, maybe an hour and 15 minutes. Obviously, I had a ride. My mom gave me a ride, and my aunt actually. And then I ended up going with my mom and my aunt back to my parents' house, and I just hung out there for a few days while I recovered. I would say the very first night, I had a little bit of pain, and they do prescribe to you narcotics. They prescribe to you like pain pills, and I had to take one pain pill. I took one pain pill that night, and then I did not feel that that was necessary the rest of the time. So that evening I felt a little bit of just discomfort. It really reminded me of having some major tooth surgery where you just feel uncomfortable, but it was nothing like unbearable or anything like that. But I did take that one time. I did take a pain reliever just to help me sleep, to help me get through that initial kind of pain. But again, by the next day, I didn't need anything like that. So I would say by that first evening after having the surgery is when I started to really swell. And to me, the most profound thing that you're going to notice with a lip lift is the swelling. This area swells a bunch anyway, and I mean, I really swelled up, and it takes quite a while for that swelling to come down. And what I found out along the way is that the center part here tends to swell the most, and it will kind of pull everything up to the middle here. And so that swelling is the last swelling to go. And I probably still have a tiny bit of it now. And I'm a couple months out of surgery now. And so what happens is as that swelling finally starts to go down, the lip will kind of normalize a little bit more across versus kind of so pulled in the middle. And a lot of surgeons will actually do a little bit of an overcorrection because they know that that's going to settle down. And of course, you don't want to go through all of that to have no results. The flip side of that is, of course, you need to be going to somebody who is skilled and, you know, board certified, all of those things, to know that they don't want to take too much either. It's very, very important that the surgeon that you choose has the ability to take the right amount of, you know, skin between. So then what I noticed every day after was the swelling went up. I got more and more swollen as the days went on, but by about day 4, day 5, I would say the swelling started to go back the other direction. Day 5, got my sutures out, and I have I just put some silicone scar things on. I'm super swollen, and the middle part of my lip is so swollen I can't hardly move it. But he said that's gonna flatten a little bit, soften, of course, like it's not gonna be feel so weird. And I'm really swollen from like here to here. So he said it'll flatten a little and come down just a touch. But I think it's gonna be pretty good. Now, I still did notice swelling for several weeks. It just was slowly resolving. And I will tell you that when I was in the middle of it, it felt like it was really a long time of swelling. But now looking back on it, I realized it wasn't as long as it felt. It just was crazy to be swollen. It can really mess with your head. Swelling really can distort everything. Now, my swelling also went out into my cheeks, and it's still a little tiny bit right here. It's just ever so slowly coming down. And so that also can change this entire area and how it looks if this part of your face swells. And so I just think it's really important to know that there will be swelling, and people swell in varying degrees. I'm one of those people that swells a ton. So if you are somebody who knows that you swell a lot, just be ready for that, because there is a little bit of a time frame of swelling. People who tell you that in 1 week you're going to be back to, you know, singing and dancing and going out on the town, I just don't think that's true for most people. I think that at 2 weeks, I felt fine to be around family and friends, but I still think that I felt like I looked funny because I was still swollen. Now, I did not notice that I had an impairment in like my speech in the very, very beginning because of the swelling, but now I feel pretty normal. So I wanted to share all of these pictures with you so that you had kind of an idea of my healing process. My number one takeaway to share with people is that the swelling can be very profound, and you have to be prepared to wait that out. It's really about time. And if you don't have at least 2 weeks to be kind of crazy looking, then this is probably not the procedure for you. I hope that this video was helpful. I hope that if you have any questions about lip lifts, I will do my best to answer any part of my experience. And also Dr. Kim, I'm sure if you leave questions down below, follow-up questions, he will be happy to answer those as well. Again, I'll leave all of his information down below and in the pinned comment. And I hope you're having a really wonderful day, and I'll talk to you in my next skincare video. Take care.